to palpation of the hip. We're gonna start off with the femoral triangle. It's gonna be like this. Superior border right here is gonna be the inguinal ligament, origin being the ASIS, inserting into the pubic tubercle. Medial border being the adductor longus, originating from the body and ramus of the pubis, inserting into the middle 1/3 of the linea aspera. Lateral border being the sartorius, also originating from the ASIS, inserting into the pes anterior. Doing the floors now. Medial floor is going to be the pectineus, origin being the pectineal line of the pubis, inserting into the pectineal line of the femur. Lateral border is going to be iliopsoas in two parts. Psoas major going to be from the intervertebral bodies, discs, and transverse processes of T12 to L5, inserting to the lesser trochanter. And then there's the iliacus from the iliac crest, or iliac fossa, into the lesser trochanter. Then inside you're going to have the femoral nerve, artery, and vein going lateral to medial. Nerve, artery, and vein. Okay. Next you got to do is the adductor group. So we already did, once you already did the femoral triangle, you don't have to state the origin insertions of the adductor longus or the pectineus, but you can still state the muscle itself. So you could already say for the adductor group, there's the adductor longus and the pectineus, and then we have the adductor brevis, which is originating from the body and ramus of the pubis into the proximal linea aspera. The gracilis, also from the body and ramus of the pubis, into the superior medial aspect of the tibia, also known as the pes anterior. And then lastly, for the adductors, the adductor magnus, originating from the ischiopubic ramus and ischiotuberosity, inserting into the adductor tubercle on this side of the femur, as well as the linea aspera. For the flexor group, you're going to do the quads. All of them are going to insert into the tibiotuberosity, and you just got to state all the origins for them. So for the rectus femoris, origin is going to be the AIIS. Vastus medialis would be the medial lip of the linea aspera and the intertrochanteric line. Lateral, or vastus lateralis, lateral lip of linea aspera, as well as the greater trochanter. And the vastus intermedius being the proximal anterolateral aspect of the femur. All of them inserting to the tibiotuberosity. If I flip them onto their side here, this could be for the abductor groups, starting with the tensor fascia lata, originating from three things: the ASIS, the iliac crest, and the iliac tubercle. All of it going to insert into the IT band, which will go distally past the knee into the Gerdy's tubercle. And then you have the glute med, which is going to be between the anterior and posterior gluteal lines. Yep, inserting into the greater trochanter. And once you're already at the greater trochanter, you can say overlying that will be the greater trochanteric bursa. And then you go to the extensor group, starting with the glute max, starting here, originating from the iliac crest, inserting into the gluteotuberosity. Then you could say the superior cranial nerves, which you palpate superior paraspinally above the iliac crest. You say do the ischial bursa, and the sciatic nerve, which is within the sciatic notches. All the hamstring muscles, you're going to say they all originate from the ischiotuberosity, except for the biceps short head, which will originate from the lateral lip of the linea aspera. Starting with the biceps short and long heads, both of them are going to insert into the fibular head, as well as the superior lateral aspect of the tibia. Symbimembranosus will insert into the superior medial aspect of the tibia, and the semitendinosus will insert into the pes anterior. That's it.